So I'm going to kick off this panel by just reminding everybody of the question here. And what we're looking at is the definition of mindfulness that we use when we're doing our teaching and grooming people into becoming mindfulness practitioners. Is this something rather similar to what we've had to do because of sheltering in home and being way more careful with tasks and things we used to do every day without much awareness, and now we are bringing awareness to many of these tasks. So the things we've put in place in order to protect us and to protect our loved ones and to protect those healthcare workers that are on the front lines, these things that we're putting in place have taken a lot more attention and awareness. And mindfulness is being aware in the present moment with intention. But the added piece that we use in mindfulness practice is, and without judgment. So that piece might not be part of what we've been doing lately with the shelter in home strategies that we've been using. So yes, we've brought greater awareness and discernment into the present moment, because when we, for example, go to the supermarket, we need to be very present with what we're doing in order to stay 6 feet away from people, in order to really take account of every move we make. And so is this mindfulness that may carry on into the future? Might we stick with some of these strategies that we've now begun to use on a more routine basis, or might they drop in time? So that's the part of the mindfulness piece be interesting to look at. But the extra piece for practitioners in mindfulness is that suspending of judgment as well. So that's a curiosity for me as to whether that becomes part of what we're doing as we're managing our safety measures in this pandemic. So if those of us who've been tuning into the national CBC many nights have been watching doctors over and over again, commenting on all these strategies that they're advising. And you may have noticed too, that they are now looking back retrospectively on some of the advice they gave at the beginning and changing it now. So things do change, and that might have been surprising for you to see that healthcare professionals do change in their viewpoints and do change in response to new research, new discovery, and so on. And so they've certainly, I think, looking back, there may be certain strategies that they wish they hadn't done. They're also, of course, basing a lot of what they've advised on what's happened in other countries. And so there's a lot of discussion about who did what right. So very interesting, very important, though, that we realize that the retrospectoscope, what we look back with, is probably a whole lot more accurate than if they were trying to make the decisions, of course, at the beginning. Can you ever make decisions at the beginning that will continue to be right? Will it always be that you'll get criticized in the future because the retrospectoscope is more accurate? So let's look at the strategies that they put in place for us straight away, given the fact that we'd seen catastrophe in China, we'd seen catastrophe in Italy and some of the other countries, we'd seen evidence of overwhelmed healthcare systems. And so at the beginning, they had to be very cautious and careful and put in place perhaps more measures than might have been needed, depending on the country. And I think it really varied culturally and certainly even provincially in Canada as to what could stick and what was needed and so on. And the provinces have behaved quite differently. Okay, so let's look at the social distancing. And I believe were you going to take this one, Alan, and speak to the social distancing? So let me hand it over to you.
Right before I get to the social distancing, there's just one thing I want to add about the mindfulness piece, more generally speaking. and when we are sort of preparing for this, and one of the questions you had asked Barb and I is to think about vigilance. You'd use the word, is our increased vigilance akin to mindful awareness? And I think that, and again, I agree, and I have a similar view to what you put out at the outset, and sort of reminding us of what the definition of mindfulness is. And it's really about being aware of what's going on both outside and inside of us. And I think with the vigilance, if we take it at a strict definition, increased vigilance could mean being aware of what's going on outside of us, but does not necessarily account for everything that's going on inside of us. So the example that you bring in of going to the grocery store, being vigilant is being careful of, making sure that we follow whatever measures we've been advised to do. But I think if you want to really be able to bring mindfulness into it, it's also about being aware that as you're doing that, perhaps your anxiety is increased. Perhaps you're feeling different sensations in your body. So it's really, although vigilance, I think, is certainly can be a piece of mindfulness, I think it's also important to remember that mindfulness is about being aware of what's going on, not only on the outside, but in our bodies, with our thoughts, with our emotions. And I think when we look at it from that perspective, it gives you a much more, mindful or complete mindfulness approach within vigilance. Okay, so the question about social distancing. And I think this is going to evolve as our situation evolves. I think that, just the term social distancing, we often talk about languaging in mindfulness, and social distancing probably would have meant absolutely nothing to most people 2 months ago. Now it's become common language. It's just something that we all understand what it means. I think in the very early, immediate, acute setting, perhaps it was a little bit difficult to get used to the idea, but we understand why we're doing it and we just implement it. Without, of course, thinking of anything beyond just preventing infection. And of course, that's an absolute necessity at the outset. It continues to be a necessity now and will be for the foreseeable future. But of course, it's one thing to be social distancing for a week or 2 weeks, and then when you get into month after month after month, I think it is worth considering, again, without ever minimizing or wanting to increase our risk and understanding why we're doing it, but also trying to understand what are the impacts. And it's not, I think it's not a if, and, or but, it's really a, yes, we need to continue to do this, and at the same time understand that it's having an impact. One last thing I'll say, and I could say more, but I'd be curious to hear what others think as well and how they're experiencing it, is that social distancing, and you may have heard, people in either health, in public health, I know in Quebec, they've tried to sort of send this message, is that social distancing should not be equivalent to emotional distancing and isolation. So they're just because we can't be physically together, gathering in rooms, there are other options that are not the same, right? That are different. But that would allow us to at least keep some kind of contact and reduce some of the isolation. And that's where I think mindfulness can be particularly helpful and useful. When we think of mindfulness as the ability to recognize when things that we used to do a certain way, we can no longer do for whatever reason that might be, and having a beginner's mind to consider, well, how could I maybe do this differently?
So just in response, Alan, too, I wanted to just add that certainly when I go to the supermarket, I'm aware of a certain amount of fear. I'm also aware of a certain amount of compassion as well for other people to make sure I'm keeping them safe as well as myself safe, and compassion for the people who are at the, who are stocking the supermarket and at the checkouts and so on. So the awareness of what's going on inside of us, for those of us who are mindfulness practitioners, does tend to be there quite strongly when I'm monitoring how far I am away from people at the supermarket, and also managing what might have been frustration in the past when I have to line up, certain distances away to get in there in the first place. So the other thing I'm thinking is that one of the things that I think might be positive coming out of this in the future, after we've gotten used to the idea of social distancing, is that it is unlikely that we'll see people in the near future going into the stores with runny noses and, you know, clearly unwell. I think it's much more likely that they'll be more vigilant about staying home or wearing a mask. And I also think that what might be a positive outcome will be that it will become unusual to see people going into work with infections. I think we're all going to be much more aware and vigilant about not doing that. And hopefully those who get sick, majority of them might be able to work from home. That will not happen with everybody. So I think that can be a problem when it comes to the service industry, such as if you're a waitress or you're a chef, and maybe you're on hourly rate. But one hopes that the future generations will not be so accepting of people going out there with infections that are obvious. So I think working from home is going to give us the ability to stay home with everybody agreeing to that and being able to work from home, especially when we're sick. And there will be fewer people now going into offices and more likelihood therefore of being able to space people out more at the offices. So I think we'll have a different routine in the future. Rather than being crammed into a workspace, there's going to be more flexibility. The other thing I'm wondering about social distancing is the parents of sick kids. Are they now going to be taking them to daycare like they used to because they couldn't miss work, so they put a sick kid in daycare? And will there be some way found around that so it'll be less acceptable to take a child into daycare who's sick? And that might be a huge problem for the parents unless employers can figure out a way of either getting the parent to work from home with the child running around, and maybe they've gotten more used to that now, and maybe the child won't be running around, maybe the child will be sick on the sofa, but the parent can still work. I don't know how that's going to work out, but I think it's going to be less acceptable taking a child that's sick into daycare. So those were a couple of thoughts I had that might continue on with the social distancing. Then I'm going to ask Barb to talk about the other aspect that was certainly a most important and initial piece of advice that all governments gave. Barb, would you do the other aspect that came along straight away?
Sure. So I think what kind of came along straight away, and something that we all maybe have done just being on automatic pilot, is washing our hands and not touching our face, and being given these very clear, repetitive instructions about not just washing your hands, but how to wash your hands, how long to wash your hands, you know, very clear over and over and over again, reiterating. So from our mindfulness perspective, it's kind of taking something, you know, when we think about being on automatic pilot, we had generally, for most of us, kind of times during the day, you were generally washing your hands, you know, after using the bathroom, before you ate, you know, maybe after you blew your nose, or, you know, but we did a lot of that without thinking, and perhaps not giving it as much thought as we are now. And so is this instruction that we've been given to wash our hands frequently and very specifically and very thoroughly, is that going to be a habit that we continue? And it was interesting when Jackie posed that, because I thought, oh yeah, so I started thinking about it, and because I know it's been, you know, quite a focus, and so I sort of was reflecting for myself in terms of how has this played out for me, and what makes it form a habit. So I was thinking, much like we were thinking about social distancing and mindfulness and being aware, it's like, okay, well, what's the emotion attached to it? You know, so will we remain vigilant with it? I think it will depend on, you know, what emotion is evoked in doing it. So if you're coming from a place of fear, you know, some people are very fearful and anxious right now, and so it's ramped up you know, a lot of anxiety around cleanliness, not just of hands, but a lot of hands, and that kind of behavior. So they've become incredibly vigilant. Um, and or is it coming from, as Dr. Jackie was saying, just in terms of, you know, when you're present, not going to be present in the grocery store when you're ill? Is it coming from a place, I was thinking, like of benevolence and care for others? And you know, I was reflecting in the last several months before COVID, I actually had ramped up in a couple of situations my hand washing a lot, because I was in the presence of someone who was immunosuppressed, and then I was also in an ICU with with my sister for several days, and so very, you know, I actually really got quite into it then, because we absolutely had to. And so when this came along, I had actually continued, not quite as vigilant as I was then, but I was washing my hand more thoroughly as I was. So then as she asked the question today, I thought, okay, well, what is going to form a habit around this? And so part of it is going to be what emotion you attach to it. You know, we know that if something has, you know, if you were, might not be a good example, but if you were a smoker and you had a heart attack and you had to quit smoking, that fear some people are able to sustain not smoking based on that fear, that threat to their health. And so is that still a part of what you're thinking? I think the other reason it may continue as a habit is the messaging is pretty persistent. You know, it's ongoing all the time. And I don't know, you know, sometimes when you get persistent messaging, you start to not pay attention, but I'm not sure that's true right now. This is something you could think about yourself. The other thing you think about is, you know, if you want to change a habit or develop a new habit or even get rid of a habit, you know, it's sort of that 15 to 21 days that you commit to it and you do it over and over again. And we're being bombarded by this every single day and paying attention every day. And so is that going to mean that we will become and maintain, you know, when we leave grocery stores, when we, you know, go into other settings, you know, in and out of different places, even in our own houses, are we going to be more thorough? I think it's possible. And we may be doing it because for our own health and well-being, for the well-being of those around us, because we just get used to doing it that way. Or we just want to make sure that we maintain, we don't, you know, touch our faces, we don't carry the germs with us. And then I thought, the other thing I was thinking about is, in terms of those of us who have a mindfulness practice, one of the, you know, if you could use this sort of, when we go back to that very beginning of the course where you do a mindful activity, is that, you know, when you're feeling anxious, sometimes it's helpful to do something that is more sensational. And the washing of your hands can feel really nice. You know, the water is there, it's warm, you can use a nice soap, and just really bring mindful awareness to the hand washing and the gift that it gives to yourself and people around you. So it will be curious to see if it stays a habit. The other piece I was thinking about too is, you made me think when you talked about non-judgment, and I think there's a little, I think it's just going to be interesting in the community around judgment. Or, you know, I was thinking in my own household, watching, you know, being on surveillance about my family members and their hand washing practices, and, you know, and my judgment coming in around that, and the thoroughness and consistency, and I don't know, I think in the community, there's people are watching, so there's more judgment out there. I think there's compassion for sure, but the judgment and the assessment, so there's kind of going to be a moral code maybe around some of this going forward.
I think
yeah.
I mean, I think that what we've learned that the general public might not have known is that when you wash your hands with soap and water, with soap specifically, we are breaking down viruses on our hands. And maybe people didn't realize that. We talk about antibacterial, but, you know, and yes, soap is antibacterial, but viruses, yeah, they break down with soap. The other thing I think that happened that we got we became aware of is how poorly we wash our hands, because we don't do a very good job. So if you kind of spray hands with a certain dye, which will come off only when you've soaked them properly, there were all sorts of places where you didn't get to before we started with this pandemic. And I think it was really useful on the National when one of the newsreaders actually showed us, with an infectious diseases person present, how poorly he washed his hands before she showed him that, and how it has to be a 6-stage process, which I certainly wasn't doing unless I was in a patient setting. But the 6, you know, the palms, and then the backs, and the between fingers, and the tips of the fingers, and then the thumb swipes, and then how they made that into a sort of a happy thing for the kindergarten children to do, so that they actually enjoyed doing that. And how I think it was on the same piece that night, it actually reduced the infections in the children in childcare, so less was coming home, which was really nice to know. And I think most of us did not know that. Although you may be perhaps happy to know that when we are when we are attached to hospitals, as physicians have privileges and the staff in the hospitals are employed there, we are asked to do videos once a year, certainly in the teaching hospitals, which are around hand cleansing and hand washing, and uses the antibacterial between patients and so on, so that nobody is ever abstractively and mindlessly going from room to room without properly washing their hands or using the antibacterial stuff. That said, I will say that after SARS in 2003, I think we were all vigilantly using the antibacterials as we entered establishments and left them, but I'm pretty sure that the antibacterial stuff was not being used very much in later years. So I think we saw evidence of the habits dropping off. And I also think that what this has taught us in this pandemic is that washing our hands is compassionate. And we've now realized that the older age group, over 60, their immune systems do deteriorate as we get older. That's part of aging. And that by being more vigilant in washing our hands, we are protecting the vulnerable. And perhaps we hadn't thought of that before to that extent. And particularly the nursing homes. So I think it's probably going to stick in the nursing homes that we will go in, use the antibacterial, and as we leave, do the same thing, and probably make sure that if in times that are more opened up, we bring the grandchildren to visit, that we're making sure we're not bringing in grandchildren who have any infections, which is hard to know because sometimes they're shedding even before they walk in. So another thing we learned in the pandemic is that you can be without symptoms and you can shed virus. Either the whole way through you have the virus, or just before you develop symptoms, or developing symptoms you hardly notice because they're mild. So there's a lot to think about in terms of the social distancing and the hand washing as well. So those are sort of a couple of things where we may become very mindful and it may stick, but let's just take a moment to just kind of contemplate, and also to take any comments or questions from anybody on this call. So Bonnie's wondering about, she says, I love the idea of tying hand washing to compassionate thoughts. Now there's an interesting thing, because in my opinion, I don't think the hand washing will stick if we don't tie it to something. And so mindfully, we can become aware of how it protects the vulnerable and also protects us from picking up infections. And I'm certainly in my senior years, so I prefer not to pick up infections from the children who bring home something that they can throw off in 2 or 3 days, and it takes us a lot longer with the same infection. So these infections can manifest themselves very, very differently person to person and age group to age group as well. Jay is saying, antibacterials are harsh on the environment. Soap and water is a better choice. And that's an important one also to bring forward. But it's also true to say that the hand washing has been very abrasive to healthcare workers' hands. And we've seen stuff on the news where their hands are red raw because of the hand washing. And it's actually, I was looking at the literature, the research literature, and the antibacterials are apparently less harsh than persistent hand washing. But I think it depends on which one you choose. And we've been advised, haven't we, in this pandemic, to use antibacterial wipes or the liquids, which are at least 60% alcohol. And if it's under that, it's not thought to be as effective. So they are putting in softeners and emollients now, unlike in the old days when I think they were much more harsh. But there's also another thing that I came across years ago with antibacterials, and that was people who'd been alcoholics or were alcoholics but were now dry and wanted to remain dry, wanted to remain away from alcohol, found it very hard to use alcohol-based antibacterials because I think it was the smell, but I'm not entirely sure. And if anybody else can enlarge on that, I think it was the smell, but it might have been that a tiny bit of absorption through the skin might have been very upsetting for them as well. They may have actually felt fear from it. Another comment, I do find myself feeling more anxious when going food shopping. Also, I'm struggling with holding judgment with others who seem not to be taking precautions or seem unaware of keeping physical distancing. And I think also we're probably coming across some people who don't even believe in it. That's a possibility too. Alan, can you take that one as you were handling the social distancing? How can we cope with those who come too close and with those who appear not to be practicing this at all? What would you suggest? How can we handle it?
First thing I just want to point out, in case some may have missed it in the chat box, MJ pointed out that the term physical distancing perhaps is being used more than social distancing, which is interesting because I haven't seen that as much on the French side, but I agree. I think it is more accurate. That's really what we're being asked to do. I think it's a really good question about the judgment piece of it. And I don't know if others have had a similar experience, but when you're exposed to the idea of non-judgment, when you're learning about mindfulness, I find some people are sometimes resistant just to that idea, with the understanding that they always felt that having good judgment is a good thing, right? And if I have a sound judgment, it makes that my opinion makes sense. And often that'll lead to a discussion that in the context of mindfulness, non-judgment does not mean not having an opinion. Perhaps it means really just being open, keeping our eyes and ears and our senses open to see what's actually going on, and then formulating an opinion rather than coming in with a preconceived opinion. So I think in this context, it's the same idea. If people are not following the guidelines, the piece about not judgment, I don't think is about discounting and saying, well, that's just their choice and there's nothing I can do about it, because this is something that's having a social impact. That's a whole other discussion about personal choices versus social choices, which is where we're at the intersection of those things right now. But having said that, if you accept the notion that following these precautions are important, and I think the majority of people do, I think it's very understandable that we might be bothered and when people are not doing it, because it affects all of us. So I think at that point, what I would suggest is trying to be aware that, again, like any other time, catch yourself judging, not bringing harshness or judging ourselves for the fact that we're judging. And then seeing, well, can I put my judgment aside and perhaps can I intervene? And that's, of course, a personal choice. Do I want to, is there a way that I feel comfortable intervening? Maybe taking the approach that maybe somebody's not realizing that they're not following it. And again, that's personal. I don't think each of us is going to feel comfortable having that kind of role. But I think that's one way of maybe being proactive and knowing that we are making a difference, and at the same time trying as best as we can to not judge or overly judge those who may not be following what the majority of people seem to want to adhere to.
Yeah, this is actually a pretty good chance to practice that suspending of judging. I think we're all encountering situations, if we do go into the stores, where somebody clearly isn't going with the 6 foot or the 2 meter rule. I saw that a few weeks ago and looked at this elderly lady who was far too close to a person in front of her in the lineup to go into the store. And my initial, I noticed my initial thing was to get irritated. And then I looked at her more closely and realized that there might be an element of dementia going on. And so that's where I bring in what I call the dialectic, the reason for why somebody might be doing something differently to the way I might. And so bringing in something which perhaps brings a little more compassion or suspending of judging, maybe there's a reason, maybe this person has just lost somebody dear to them and they're just not able to be present right now in the way that many of us have to be present right now. I saw 3 teenagers today walking closely together in the drugstore, and I looked at them and my first thought was, why? Because my first thought was, you can't all be living together. And then my second thought, well, maybe they are, because we can be close to people we're living together with. So I think suspending of judging and making sure that we're maintaining our own distance, we're looking after our own aspect of this. And sometimes I have actually said to somebody as I've skirted by them, I'm just staying 6 feet away, and it's kind of like a reminder, but I'm doing it in a body language, a nice way with a good tone to my voice that doesn't suggest that I'm irritated. And so doing that. Linda is saying that she's finding herself a bit judgmental when surrounded by shoppers without masks or gloves. And I thought, well, actually in my area here in Port Hope, Ontario, very few are wearing masks and gloves, but Linda's in Georgia. So it might be quite different as well. So yeah, I think, again, there's going to be different things going on in different places. And really, will it stick? Is somebody wanting to open their mic and speak?
I'm trying, but I don't. I was just saying that it's Mary, I'm 89. When I'm washing my hands, I sing or hum Happy Birthday twice. And that gives me the proper time for washing all around. But it also clears out mucus. If I'm singing, any mucus in my throat gets cleared out too. Anyway, it works for me, and it gives you that time.
It's a good idea. And yes, the happy birthday song, actually sung once apparently, is about the right timing for the process of washing one's hands. So yeah, I wonder if that will stick. That's an interesting one, Mary. The sad thing is that, if we don't get another wave or another reminder of what might be to come, and it might be another virus in the future, who knows, we may be going into a very different era where we have to be more cautious and more thoughtful about protecting our vulnerable elderly and vulnerable immunosuppressed people. If we don't get that, we may fall off in these habits. And I think Barb mentioned that there might be some way that we can institute more measures of reminders, of keeping things up, of keeping things going, of public education, so that there are fewer infections coming out of daycares and there are fewer people going to work or to daycare with infections, and that it becomes more acceptable to stay home and shelter from others when we do have the infections. And that said, by the way, if we're too clean and we have disinfectants everywhere, there has been some research to show that being too clean is not good either. that it means we don't get mini exposures to things that give us little bits of immunity, so that our overall immunity is beefed up from time to time. This is why infants sitting on the floor, or you know, as they get to sort of a few months old, start putting stuff in their mouths, and you know, mums think, oh, that's so filthy, and essentially it's been shown by research that they are acquiring little bits of immunity by putting toys in their mouths. And of course, as they go through daycare, they're acquiring immunity, which assists when they get to kindergarten in keeping them in school, so they're not off ill every 2 weeks. If a child hasn't been in daycare before she goes to kindergarten, then chances are they're going to be off much more frequently than their contemporaries who have been in daycare.
Wear a mask today, and I found that when I was putting on the mask and I wanted to speak because I was explaining a complication I was having, it was actually sucking right against your face, that I was actually pulling it away to speak, where it looked like I was taking it off, and you could see a couple of people getting a little upset, wouldn't really be the right word, but you know, I guess observant of it. But is there a secret in using it? Because since I've been so isolated, today's the first day I've really had to do a mask.
So I'm going to actually toss that to Alan in a minute. But interestingly, when we began this pandemic, they were suggesting not masks because they were afraid of that very thing you talked of, that it would bring the hands up to the face where they don't want the hands to go, in order to fiddle about with the mask and the elastic. And they felt that that was going to be just as bad as not wearing a mask at all and keeping your hands away from your face. So in other words, they felt the mask might increase the dangers. And then later on, as Dr. Tam has shared with us, the research was coming out that the masks were providing a measure of protection, and that you could get cloth masks, throw them in the washer, and so on. But Alan, would you like to address Marianne's issue about this sucking in part?
Sure. So I can give you a bit of my personal experience. So I do work on, I still do some work in the hospital, and sometimes I right now, and again, as Jackie's mentioned, the guidelines have been shifting outside of hospitals and within hospitals, but for the last few weeks, we wear masks all the time. Regular surgical masks. I'm not talking about, there's very specific masks for specific procedures, but the sort of the regular surgical mask, which is probably what you had, what you were asked to wear, Marianne. So, so I have the ones that are issued by the hospital, or by which are really medical grade surgical masks. But I also have a cloth one that I use when I'm out in the community. I don't go out very much, to be honest, but I have one. And what I can tell you is that the type of mask that you may have actually is very important. It makes a very big difference. And the cloth masks that I got, that my wife ordered from someone, is far less comfortable to wear and to use than the one that I'm given at the hospital. The one that I'm given at the hospital, I could wear it all day probably. Not that it's great, but I could wear it all day and it really wouldn't cause me any difficulty breathing at all. The cloth one that I have, which I think is good, is really, I think, best to be used for short periods of time, you know, maybe 10, 15, 20 minutes. I cannot imagine wearing that for longer. With the issue of it becoming close to your face, it's hard to say, but I would imagine that probably it would need to be adjusted. I mean, they're really made as a one size fits all, and which really will primarily depend on the whatever's holding it up. So whatever's around your ears, and ideally it should be more elastic than less, because that will allow you to adjust it. But I would imagine a lot of the cloth ones, depending on how they were made, may not allow any adjustment.
But I wonder how Marianne Marianne, did you have something here that you could pinch your nose with on that mask, and was it a sort of a paper mask that was issued to you?
It was the standard one done by the hospital, because they didn't want us to use our personal ones. So when I had one going in, then I had to put that aside and use this. It was just the really thin ones that wrapped around your ear. And because I guess I wasn't used to it or what have you, it just caused it. And I guess I didn't, when I wore the one I have when I went, because I needed it for my wheel trans, I don't do a lot of talking with the mask on, except for today because I had to explain some of the complications. And with the breathing and everything else, I just found that there was a lot more activity. And then, of course, where I normally don't have a lot of activity around my face, I've been finding that, well, I had a lot of activity when I was there, trying to pull it away from my face and so forth. But that was a good idea. And then, yes, and I guess because I haven't had to wear a mask, it's like putting on a brand new pair of shoes. You're not always aware of how comfortable everything can be because I've been so isolated.
Yeah, I think that maybe because you were breathing quite heavily because of the exertion being unaccustomed, it might have sucked it in as well. So there are all sorts of little bits there that you needed to get accustomed to. But see how you go, because obviously going forward for wheel trans and so on, you will need to wear a mask. There are going to be some times when you're absolutely required to. And if you can, I don't know, if you can experiment with 2 or 3 different types and really also get some help from the person who hands you the mask as you go into the hospital, just to be sure that you've got it on correctly, maybe ask.
Well, this is a new update with wheel trans, that if you do not have anything to cover your face, you're not allowed to go on, period.
That's
and then they do a questionnaire with you over the phone to make sure you meet certain criteria, and still all of these things are in place, or the driver can actually decline you on the pickup.
Yep, and that's the question, is how much of this stuff that we are getting used to now is actually going to be long term and stick, because we've seen for, I think, a long time, we've seen some of the countries in the Far East commonly wearing masks in the street, and we tended not to this side of the continent. But are we going to be doing that? And that concerns me somewhat, because even though, you know, there's now some evidence to show that it's beneficial to wear masks in terms of not being able to cough stuff out over others, but also inhaling less or taking less droplets spread in, or whatever it is that's coming in. I guess it also keeps you from touching your face. If you have a mask on, for me, it would prevent me from touching my face if I had a mask on. But the downside could be that we're not able to communicate with expressions easily anymore. It's going to be hard to even know someone in the supermarket that normally you'd say hi to, because you're not sure who they are. So it's going to cut down on some of the interpersonal contact, some of the expressions that we rely upon to communicate with each other. And I'm getting hard of hearing. So if people are going to be talking to me through masks, I can no longer use a little bit of lip reading, and it's also muffling their voice. So for those of us who have any form of difficulty hearing, the masks are going to be difficult to contend with, I would say. So yeah, that's a little bit about masks as well. Are they going to become something that a year from now, 2 years from now, we're still going to be required to wear in such cases as wheel trans and maybe some of the clinics and so on? So yeah, and Linda's commenting as well that with therapists trying to do therapy with their clients, it's going to cut down on those sort of body language, facial expressions that go along with making good choices in terms of interacting in therapy. And so, of course, does using telemedicine as opposed to, or videos like this, as opposed to meeting in person. Although we found that Zoom is pretty good still at doing mental health work, and that we can do mindfulness-based chronic pain management courses through Zoom. So you will see probably more of that. We certainly did it through telemedicine in the past. So I'm just surveying some more of the comments at the side, and we only have a few moments left. But we've covered a fair bit of ground. Alan looked into cardiac rehab. You know how people, after they have cardiac events, they may be put through a program which improves their health habits and is designed to decrease some of the things that may have led to the cardiac events. And interestingly, I mean, people can be very, very motivated when they first go into cardiac rehab and have this passion that they're going to continue to do this work so that their life is changed in terms of risk factors. But if they sort of then go through the next few months unscathed, that resolve can drop off. And so that's kind of likely to be happening unless we reinforce with measures as we go forward. Everything we think is a good thing to do, like, yes, I'm going to facilitate MBCPM courses after I've done my training, may in fact drop off in resolve when life gets busy and you haven't implemented what you were intending to. So lots of things do fall by the wayside if there's not enough reason to continue doing them in your mind. So lots of chat about masks as well.
If I can jump in, Jackie, just an interesting, Bay, you said something on that is very interesting to me, because it caught my eye that you say you felt quite relieved when you see people wearing masks. And I happen to know that Bay shares her time in different parts of the world. And what's interesting to me is I have a good friend of mine who's Canadian, but has been living in China and Taiwan for the past 20 years. And months ago, and now he lives in Vancouver, but months ago, he was up in arms about why we're not wearing masks. Why are we not wearing masks? He just couldn't get over why in Canada they're not telling everyone to wear masks. At the same time, our public health, the head of our public health department, who was giving daily briefings with our premier, at one point, actually a couple times, he made a comment at a press conference saying it's not within our culture in Quebec, and I think probably could have been said in Canada, to wear masks. And I thought it was a strange thing to say, because I was looking at it from a very medical model, thinking, what does culture have to do with this? I mean, either we know that it helps or it doesn't help, but whether we're culturally used to it or not shouldn't make a difference. But it was interesting that he brought it in, and I don't know what people think, but certainly I think it probably, it's funny, I said certainly and probably in the same sentence, but I do think it probably had an effect into maybe delaying when masks or the recommendations for masks were brought in. So because a lot of this is science, but the science is evolving, and the science is not based on as much fact as we would like it to be based on. So there certainly are probably some cultural aspects that came into play here.
Mm-hmm. Yes, I think so. I mean, I think there are some people who are very, very adamant that masks should be worn. Somebody has mentioned that unless it's an N95, which is the hospital grade, you know, ultimate mask that's quite uncomfortable to wear for long periods of time, unless it's that one, it's not really filtering out the COVID-19. But I do think that it is helping, and now they've shown that it is helping us not to take in some of the stuff that we might have done if somebody around us is shedding COVID. And maybe too, by touching the surfaces they've touched, we have a barrier to putting our hands near our face. But originally, it's true to say, Alan, that the powers that be that were advising us were worried that it would cause the hands to come near the face because we were adjusting them so much in a somewhat the way that Marianne described, where she had to pull it away because it was getting to be intrusive. And I think that was the worry.
I think that was one worry, and a second worry to that as well was I think they were afraid that the message may be that, well, as long as you're wearing a mask, it's okay to go out. And they wanted to make sure that physical distancing is really your number one choice. And if you don't have a choice, then if you have to go out, perhaps a mask. But I think they didn't want that message to be blurred.
Right. And then, go ahead.
I was going to say, my daughter lives in Norway. I talk with her frequently. She said that in Germany and France, it is legally compulsive that you must wear a mask.
Wow. So different countries are doing different things, and I believe Sweden certainly hasn't been as stringent in what they have recommended. But they're also a country that is culturally very different from, say, the United States. And so they have propounded that the social distancing is advisable, but they haven't forced anything. They haven't, you know, made it unlawful to do some of the things that in other countries have been proclaimed as unlawful. And yet Sweden isn't having a massive, you know, increase in their COVID infection rate compared to other jurisdictions. So I'm just still looking at some of the chat, talking about visual cues. So another piece that's sort of like in place of the idea of mask is interactions done through the screens. And so using screens more. At first, people were really reluctant to use screens. The doctors didn't want to. They found them fiddly because they were sort of new to the screen idea of interacting with patients. And so they preferred to use phones. But the screens do add another element of being able to interact with somebody. And on a screen, you don't have to wear masks. So you can see somebody's face and you can see expressions. And so it does give some of that. And I found that missing my grandchildren who are in Ottawa and in Montreal, and it wouldn't matter if they were around the corner, we're not supposed to mix households, but the screen has been better than using a phone or using text, so that I'm able to read bedtime stories to my little grandchildren using this method here, this Zoom method. And you know, we've blown out birthday candles together with 3 households on the same screen. So there are ways actually that maybe going forward, the screen, getting used to it, getting more comfortable with screens might be of benefit. And it might actually reduce loneliness, because there are a lot of people out there that are living alone, more vulnerable, can't go out as much as we age perhaps as well. And so maybe this has introduced an era, a new way of being able to use screens, which of course are very protective, in order to have more contact with family members, with friends, that, because a lot of the time we're not picking up the phone, and you know, when our family members are very busy, sometimes we don't like to bother them, but through a screen, through FaceTime, through Zoom, there may be actually more interaction. You can even just have dinner together. You can sit your iPad on a table and decide to have dinner at the same time, and it can sort of promote that sort of interaction that maybe we hadn't thought of before. And I'm just wondering if you think that that also might be something that might stick going forward.
Jackie, I just set an appointment yesterday with my neurologist on Zoom.
And how did it feel, Sherry? Did it feel like it was almost as good as seeing them in person, or better because you didn't have to do the commute?
I don't mind the commute because I ended up meeting some friends down in Toronto. But it was pretty good because we had a couple laughs and whatever. But we actually talked about that, about having the appointments that way. I said, she said, no, I'm going to see you in person next time.
Yeah, I think it's more accessible, Sherry, as well. I think actually at the moment the doctors are finding that using screens and telephones, because they're not as busy as they were outside of the pandemic, or at least I'm generalizing, but the ones who are not on the front line dealing with COVID seem to, like the surgeons and so on, because a lot of elective stuff got put aside and a lot of the appointments got cancelled, they're having a bit more time to, and it's a little quicker. Plus, you're not having to wait in waiting rooms or go into areas where you might be more at risk. So it's really,
they're right down at St. Mike's too. So who wants to walk around all of that, right?
And parking as well. You know, I mean, go to Sunnybrook and you're parking for $22. So to be able to interact through screens, as long as there isn't something they physically need to, you know, work with you on, then I think the screens are giving much more freedom of choice. I think patients actually are giving feedback to their doctors that they prefer it. Yeah. But the problem is that at some point when the pandemic is past, then OHIP may not allow coverage of phone calls and Zoom meetings. They
Right.
do allow it for telemedicine, but that's a bit more cumbersome, and some doctors are not going that route. If it's through a screen, which is what you've just described doing yesterday with your neurologist, there's one chat piece which says, I would be more verbally descriptive than I might be in person, because I would be aware that my physician or my therapist wouldn't be able to read my visual cues or body language. And it might mean that also the whole session gets shorter because it's more tiring than in person. That's interesting. I know I listen very, very hard through screens not to miss something. So for some people, they actually get quite fatigued by using screens to interact. And another question was, I wonder if a highly sensitive person is more likely to react negatively to lack of personal protection equipment on others. And if so, we might need to be more sensitive to our trauma-impacted patients and clients, because highly sensitive people are highly represented in the pain population. So they may be more scared and more judgy about people who might be impacting on that 2 meters, or who are not wearing protective equipment when they should. Okay. 7 United States out of 50 have mandated mask wearing. Wow, when outside. And then this issue of, wait a minute, young children exposed to more screen time, it's supposed to be harmful to brain development. I wonder about that, because I think there is some research that suggests that learning through the screens with their teachers at the moment hasn't proved as negative as they thought it might. And maybe it's the type of stuff that they're exposed to that could be important as well. Okay.
There's an earlier one, Jackie, I just want to mention it. It's not pertaining to mindfulness specifically, but I think it's important, and it comes to the related to the Sherry, as she saw her neurologist, but someone had mentioned that there are many people who are afraid to go into ERs or consult, and who have serious, important issues. So it's absolutely an important to raise. And someone mentioned a cardiac issues, and we are seeing patients who are delaying getting help because they're afraid. So I'm not sure what the setup is in Ontario, but probably very similar to what it is in Quebec, is that most physicians and clinics are trying to be available to at least triage things over the phone, and then encourage people to come in when they need to. So yeah, absolutely, there are many things that can be done over the phone, and other things where you really need to be. I mean, if you're having a cardiac issue, you need to go to the hospital, and the hospitals are set up, of course, to receive you.
And I think that all that prep time they had at the beginning, when we first started to put things in place, allowed them to create care plans which make things much safer now than perhaps a couple of months ago when they were just putting it together. Barb, any last comments that have come up for you?
Just in terms of, thinking about providing support virtually or over the phone, and being sensitive to, because I don't just do this group, I see clients individually as well, and adapting. And I think part of having our mindfulness training is that check in with yourself, and just always coming back to how, when you feel that reaction in your body, whether it's me in my counseling role, or me personally with my family, or me out in the community, and same with all of us, is that little pause to check in and think, okay, what do I want to do next? Or what's in my best interest to take care of myself, and reaching out for support, because the physical distancing is not meant to be social isolation. So, all your comments have been really very heartfelt, and certainly continues to give me food for thought. So thanks.
I think we all give each other food for thought. It's great to have sort of such input. Thank you for attending, and thank you so much for contributing. And thank you to Barb and Alan for sharing the panel with me.